We begin our broadcast tonight in Uganda, where the government has called the country's doctors unprofessional, selfish and patriotic and enemies of the people after calling for a sit-down strike in 2017 demanding pay and improved working conditions. Halima Athumani spent a night at an Ugandan hospital and shows us the challenges doctors face.
Lack of adequate drugs and other medical supplies and understaffing, while the few health workers have to give their all to handle patients. Uganda's doctor-to-patient ratio is estimated at 1 to 25,700, yet the World Health Organization recommends one physician per 1,000 people. Nakaseke Hospital, 136 kilometers northwest of Kampala, serves 5 neighboring districts. In the 50-bed postnatal ward, 22 mothers and 14 babies are being watched over by one senior nurse and doctor. Mariam Kabuzi, a new mother of twins, was separated from her babies because the hospital does not have a neonatal intensive care unit or several prescribed drugs. Kalunji Yunus is Mariam's father.
There
is not enough medicine. They gave her 3 different prescriptions, but the hospital was only able to give us 2, so I had to buy the 3rd from an outside clinic.
In the operating room, a mother is suffering from obstructed labor. With just 2 doctors and a nursing assistant, an emergency cesarean section operation gets underway and will last for about an hour. While there is an anesthetic machine, the lack of halogen gas to put patients to sleep during the operation renders it idle and sealed. Working with little, the doctors struggle through the night operations, knowing they could lose the patients. But against all odds, the operations end well, and 2 girls are born within a space of 3 hours.
Ideally, a theatre should have the surgeon, an assistant, an anesthetist, a rotating nurse, and then another aid for instruments. If you lack something, you can send for. But we were working on the 2, and it's not by choice, but by the number of staff that we can organize. So ideally, staffing is still a problem. You can see how I'm sweating, there is no AC, even if it's at night, but you can really feel how hot it can be, especially when you are working.
The 2018-2019 financial year saw the Ministry of Health budget increased to $594 million from $470 million. Slight increases were given to local government health centers for primary health care, wages and medical and health supplies. But Ministry of Health Permanent Secretary Dr. Diana Twine argues the lack of adequate medical supplies can be successfully handled if the incidence of disease is reduced.
So our target now as a sector is to reduce on the disease burden, to make sure that all the preventable diseases are reduced. Once we reduce, then the money will be saved to cater for, lifestyle. And even the lifestyle, that's why we are talking about sickle cell, that's why we are talking about diabetes, hypertension, even those non-communicable diseases.
But the situation remains dire in these hospitals, where one could mistake an operating room for a slaughterhouse. Halima Athumani for VOA News, Nakaseke, Uganda.